The first thing Evelyn Carter noticed about the nursing home was the quiet. It was the kind of quiet that made you unsure if it was peace or neglect. At 72, she had just come out of hip surgery. Her daughter, Lorraine, had worked hard to find a place that seemed right. Clean halls, kind voices, and a brochure that promised AI-powered personalized care. The woman at the front desk had said it proudly, like the letters A and I were proof of progress. Evelyn smiled politely. She did not know much about computers, but she liked the sound of personalized. She thought it meant someone would actually see her. Her room was small but tidy, a single bed under a window that looked out onto a courtyard with trimmed bushes and a stone fountain. A monitor on the wall showed her name, age, and a line that read, "Status, low risk." She pointed to it and asked the nurse, "What does that mean?" The nurse, a young woman named Marissa, smiled gently. "It just means the computer thinks you are doing well." "Well, the computer has not seen me try to get out of bed," Evelyn joked. Marissa laughed, then adjusted her blanket. "Just press this button if you need anything," she said, pointing to the small gray remote on the nightstand. That night, the pain started deep in her hip, a dull throb that spread down her leg. Evelyn pressed the button. The light above her door blinked once, then stayed red. She waited. 5 minutes passed, 10. She pressed again. Nothing. She looked at the clock on the wall. It was nearly 11. She could hear faint footsteps and the distant sound of a television from another room. After 20 minutes, she whispered to herself, "Maybe they are busy." She pressed the button again. Nothing. By the time Marissa finally walked in, nearly 40 minutes had passed. Evelyn's voice trembled. "I'm sorry to bother you, but I have been ringing." Marissa looked pale. "I'm so sorry, Miss Carter. The system flagged you as low priority for the next round." "Low priority?" Evelyn repeated. "It does not mean you are not important," the nurse said quickly. "It just means your status is stable, so the computer scheduled check-ins for others first." Evelyn's face softened. "I guess I should be thankful for being stable," she said quietly, but there was no humor in her tone.
The next morning, Lorraine visited. She found her mother sitting up in bed, her eyes tired. "How was your first night, Mama?" "It was quiet," Evelyn said. "Too quiet." Lorraine frowned. "Did they not check on you?" "Not for a while. The nurse said the system thought I was low priority." Lorraine's eyebrows lifted. "What system?" "Some kind of computer that decides who gets seen when." Lorraine pulled her phone from her purse. She searched the home's website. On the home page, a headline read, "Revolutionizing Eldercare Through Data-Driven Efficiency." Beneath it was a smiling senior holding hands with a nurse. Lorraine showed it to her mother. "This is what they are using," she said. "It says the program monitors vital signs and predicts who needs more care." Evelyn looked at the picture. "That lady looks happy," she said. "I wonder if the computer gave her a better score." That night, Evelyn watched the hallway light outside her door flicker on and off as nurses moved from room to room. She noticed they stopped more often at rooms with red screens above the doors. Her screen stayed green. She whispered, "Green must mean good." But her hips still throbbed, and the quiet still felt heavy. Marisa came by around midnight, tired but kind. She adjusted Evelyn's pillow and checked her chart. "Everything looks good," she said. "The system shows no alerts." Evelyn smiled faintly. "Well, the system must be sleeping better than I am." The nurse hesitated. "We try to override it sometimes," she said softly. "But if we spend too long with one patient, it marks us for inefficiency." Evelyn looked up. "So even you have to answer to it?" Marisa nodded. "I do not like it, but that is how they manage staff now." When the nurse left, Evelyn turned her face toward the dark window. She could see the faint reflection of the monitor light on the glass, glowing green beside her bed. She whispered to herself, "The computer called me stable. My body says otherwise." Lorraine could not stop thinking about what her mother said that morning. A computer decided when someone checked on her. That didn't sound like care. That sounded like scheduling. When she visited again the next day, she found Marissa, the nurse, filling out digital notes on a tablet near the nurse's station. "Excuse me," Lorraine said. "Can I ask how this system actually works?" Marissa looked up, a little nervous. "It's called CareTrack. It helps us plan our rounds." "How does it plan them?" "Well, each resident has a score. The computer uses that score to set how often we need to check on them. Higher score, more attention. Lower score, fewer visits." Lorraine crossed her arms. "And who decides the score?" "The machine," Marissa said. "It looks at things like age, vital signs, and how often someone presses the call button. If someone seems stable for a while, their priority level drops." "So my mother's problem is that she doesn't complain enough?" Lorraine said dryly. Marissa hesitated, then nodded. "Honestly, yes. The system reads silence as improvement." Later that evening, Lorraine explained everything to her mother. Evelyn listened quietly, her hands folded on her lap. "So let me get this straight," she said. "If I stay quiet, the computer thinks I am fine." "That's right, Mama." "And if I speak up too much, it might mark me as a high-need patient?" Lorraine sighed. "Probably." Evelyn shook her head. "That sounds less like care and more like guessing." The next morning, Dr. Simmons, the home's medical director, stopped by. He was a kind man, gray hair, gentle tone, always rushing from one hallway to another. Evelyn asked him, "Doctor, how does that machine know I need help before I do?" He smiled. "It doesn't really know, Miss Carter. It predicts." "Predicts what?" He pulled out his phone and showed her a chart. "It uses data from hospitals, insurance claims, and patient histories to spot patterns. It can tell who's most likely to need attention soon." She frowned. "Patterns from who?" People like you," he said automatically, then paused. "Well, mostly from nursing homes that joined the program early, big ones, private ones." She nodded slowly. "I see. So it learned from people who can afford more care, and now it tells you how to care for people like me." Dr. Simmons looked down, uncomfortable. "That's one way to put it, yes." That afternoon, Marissa came in to check Evelyn's vitals. The tablet beeped. "Patient stable. Reassess in 8 hours," it read in blue letters. 8 hours? Evelyn repeated. "What if I need help sooner?" "Then you call me," Marissa said. "What if you don't come, like last time?" Marissa sighed. "Then I'll get an alert for missing the schedule." "So the computer tells on you too?" Marissa smiled sadly. "Pretty much. It grades us both, Miss Carter." Later, Evelyn sat by the window, staring at the quiet courtyard outside. She thought about how the brochure had promised AI-powered care like it was something to be proud of. It wasn't that she hated machines. She had used them all her life. Cash registers, microwaves, even her daughter's tablet for video calls. But she had never known a machine that measured comfort in minutes and empathy in efficiency reports. She looked at the glowing green light above her door again. It meant she was stable, but it felt like it meant she was forgotten. That evening, Lorraine called her brother Marcus, who lived in Chicago. He worked in hospital administration. "Marcus, do you know about these systems that assign care by score?" "Yeah," he said. "A lot of facilities use them now. They're supposed to save time and reduce burnout." "Do they work?" "They work for the budget," Marcus said. "Not always for the people." Lorraine's voice dropped. Mama almost went all night without care because the system thought she was low risk. That's the problem. These programs are trained on what sickness looks like on paper, not what it feels like in real life. Evelyn lay awake that night, the hum of machines soft around her. She thought about what everyone had said: prediction, efficiency, data.
All those words sounded clean and smart, but none of them sounded like care. She whispered to herself, "Maybe the system is doing its job. It just forgot that I'm more than a number in its plan." Technology can count pulses and patterns, but it cannot hear pain. When care becomes a calculation, silence becomes a false sign of health. Next, Evelyn discovers what the computer never measured, the things that make people human.
Days passed, and Evelyn began to see the rhythm of the nursing home. Not the rhythm of people, but of screens. Each nurse carried a tablet that chirped every few minutes, reminding them where to go next. Every visit started the same way. A tap on the screen, a polite smile, a line read aloud from a chart. "You're doing well, Miss Carter. The system says your recovery is on track." She wanted to ask, how does it know that? But she didn't. She could tell the nurses were tired, rushing to stay on schedule. At breakfast one morning, she sat beside a woman named Ruthie, who used a walker and had been there almost a year. Ruthie whispered, "You know, the computer doesn't like talkers." Evelyn laughed softly. "What do you mean?" "When I complain too much, my check-ins drop. It's like the system gets tired of me," Ruthie said. Then she pointed to the blinking light above her door. Red means, watch closely. Green means, let her be. Evelyn looked up at her own light. It was green. "So the colors decide how human we are today?" she murmured. Later that day, Marissa came in with her tablet. Evelyn watched her scroll through rows of numbers. Blood pressure, temperature, medication logs. "Is that all it tells you about me?" Evelyn asked. Marissa smiled kindly. "It tells you your vitals, your meals, your movement levels. Everything important." "Everything important," Evelyn repeated. "Does it say I had a nightmare last night? Does it know I haven't eaten half my lunch in 2 days?" Marissa lowered the tablet. "No, it doesn't track that." "Then how does it know I'm doing well?" The nurse didn't answer right away. She closed the tablet and sat on the edge of the bed. "Because it only measures what it can see," she said. "And sometimes that's not enough." That night, the hallway lights dimmed at 9. Evelyn stayed awake, staring at the ceiling. She thought about all the things the machine didn't measure: the ache behind her ribs when she missed her old house, the small relief when someone held her hand, the fear that came when she realized she had no control over her care. She whispered into the quiet, "You can't put that in a spreadsheet." The next day, Lorraine visited again. She brought Evelyn's favorite biscuits from home. "Mama, how are you feeling today?" "I'm fine," Evelyn said, though she didn't mean it. Then she added, "Do you know that machine they use doesn't count feelings?" Lorraine smiled softly. "No machine can." Evelyn nodded. "But it tries, and when it can't, it just leaves them out, like they don't matter." Later that week, a small meeting was held in the activity room for residents who wanted to talk about the new AI system. Evelyn went. So did Ruthie and a few others. The administrator, Mr. Harland, stood at the front with a slideshow on a projector. "This system helps us save time," he said cheerfully. "It allows our nurses to focus where they're most needed." Evelyn raised her hand. "And how does it know who's most needed?" "It uses patterns," he said. "Data from thousands of residents." Evelyn tilted her head. "Were any of those residents from places like this one?" He blinked. "I'm sorry, ma'am." She continued. "I mean, people like us, older black women on fixed incomes. Were we part of that data?" He cleared his throat. "I'm not sure, but the system was tested broadly." Evelyn nodded slowly. "Broadly," she said.
That's another word for not exactly you. The room fell quiet. Even Ruthie smiled at that. After the meeting, Marissa caught up with her. "Miss Carter, that was brave," she said. "It wasn't brave," Evelyn replied. "I just wanted to remind them that health isn't math." Marissa nodded. "You're right, but they'll listen to you more than they'll listen to us." "Then we'll both keep talking," Evelyn said. That night, Evelyn wrote in her small notebook, "The computer can count my heartbeats, but not my heartbreak. It knows when I've eaten, not when I've lost my appetite for life. It calls me stable because it cannot feel the tremble in my soul." She put down the pen and looked at the green light glowing above her door. "You can keep your color," she whispered. "I'll keep my voice." Machines can see numbers, not nuance. They record improvement, but miss isolation. They measure the body, but forget the spirit. Next, Evelyn learns that when systems fail, it's rarely by accident. It's policy made convenient.
2 weeks after the meeting, Evelyn's daughter Lorraine requested to speak with the nursing home director. She didn't want to be rude, but she wanted answers. The director, a thin man with careful manners named Mr. Harlan, greeted her in his office. The walls were lined with awards and framed certificates about innovation in eldercare. Lorraine took a breath. "My mother says the system decides when she gets checked on. I need to understand how that's allowed." Mr. Harlan smiled politely. "The algorithm helps us manage time efficiently. It ensures that residents with higher needs get immediate attention." "But who decides what higher needs means?" "The program analyzes patient data and assigns a risk level," he explained. "It's all based on medical evidence." Lorraine leaned forward. "Then why was my mother left alone for almost an hour on her first night?" He cleared his throat. "The system must have classified her as stable." "Stable doesn't mean comfortable," she said. He nodded, but his tone stayed calm, rehearsed. "I assure you, Miss Carter, this technology improves care outcomes overall." Overall. Lorraine hated that word. It sounded like an excuse built into a sentence. Later that afternoon, Evelyn saw her daughter walking down the hall with her arms crossed, eyes sharp. "What happened, baby?" Lorraine sat beside her bed. "The man said the system follows state policy. If they override it too often, they lose funding bonuses." Evelyn blinked. "So checking on me costs them money?" Lorraine nodded. "In a way, yes. The system tracks how many staff hours go to each patient. Fewer hours look like efficiency." Evelyn sighed. Efficiency. Another pretty word that hides ugly things. That evening, Marissa came in looking tired. She whispered, "Miss Carter, I might get written up for staying too long in this room." Evelyn frowned. "You're just talking to me." "They track everything," Marissa said quietly. "Every minute, every stop. The policy says we have to stick to the plan, or explain why we didn't." Evelyn shook her head slowly. "So the system tells you who to see, and the policy tells you you're wrong if you disagree." Marissa nodded. "It's a loop, Miss Carter. Nobody wins."
A few days later, Evelyn's hip pain worsened. She pressed the call button twice before anyone came. By the time Marissa arrived, Evelyn's temperature was high and her voice weak. Marissa checked her vitals and frowned. "I think you're getting an infection." She entered the data into her tablet. The screen blinked, then displayed a message. "No immediate action required. Monitor next shift." Marissa cursed under her breath. She went to find a supervisor. When she returned, she carried antibiotics and worry in her eyes. "I told them you need treatment now. And they listened? Only because I refused to close your chart." 2 days later, Evelyn felt better, but the anger had settled deep in her chest. She called Lorraine and told her everything. Lorraine shook her head.
I'm going to file a report. Who are you going to report to? The State Health Department, Lorraine said. Somebody has to know this system is cutting corners. Evelyn smiled faintly. Make sure they know it's not the nurses who failed me. It's the policy that keeps their hands tied. A week later, Lorraine received an email from the state's oversight board. Thank you for your concern. The facility is in compliance with all current digital care management guidelines. The system has passed performance audits. Lorraine read it twice. Passed performance audits. It was the same kind of polite indifference her mother had faced all year. She forwarded the email to a local news reporter with one sentence. Can compliance still mean neglect? When people and policy collide, empathy gets stuck in the middle. Every layer, the nurse, the manager, the regulator, points to another. The system protects itself first, the patient last. That night, Evelyn wrote in her notebook. They say I'm safe because the numbers look good. They say she's efficient because she follows the plan. They say the system works because no one breaks the rules. Then she added a final line. Maybe the rules are the problem. She closed the book and turned off her lamp. Next, Lorraine starts to follow the paper trail. What she finds buried in the fine print reveals that the algorithm's real goal was not better care, it was cutting costs.
Lorraine had worked in offices most of her life. She knew that if something didn't make sense in person, it probably made sense on paper. You just had to find the right file. The morning after receiving the state's email, she began her search. She called the company that built the CareTrack system and asked for their public materials. The representative said politely, "We don't share proprietary algorithms, ma'am, but our technology has been recognized for improving efficiency by 22%. Efficiency, again, she thought. The word was everywhere, in the brochures, in the policy manuals, in every conversation that excused what happened to her mother. She decided to start with the nursing home itself. She visited on a quiet afternoon when her mother was napping and asked the receptionist if she could see the CareTrack brochure. The woman handed her a glossy folder with smiling seniors on the cover and a headline that read, Efficiency through Predictive Care. Lorraine sat in the lobby flipping through the pages. The text sounded reassuring. Optimized care hours, data-driven compassion, patient-centered technology. But buried near the back, in small print, she found a sentence that made her stop. Care hours are allocated based on performance benchmarks designed to improve operational efficiency and resource distribution. She read it twice. Operational efficiency. That wasn't about care. That was about cost. That evening, she showed the page to her brother Marcus, who worked in hospital administration. Marcus frowned. This looks like a billing formula, not a care plan. What do you mean? See here, performance benchmarks. That's the language of profit. It means the system rewards the facility for spending less time per patient. Lorraine stared at him. You're saying the fewer hours the nurses spend with my mother, the better the numbers look? Exactly, Marcus said. It's called outcome optimization. They count minutes like dollars. The next day, Lorraine met with Marissa during her break. She handed her the brochure. Do you know what this really measures? Marissa scanned it, her face tightening. I had no idea. We were told it helped distribute our time fairly. Fairly for who? Lorraine asked. Marissa shook her head. We just follow the schedule it gives us. If we deviate, it flags us for inefficiency. So the system scolds you for showing compassion? Lorraine said. Pretty much, Marissa admitted.
Lorraine kept digging. She looked up the company's filings in public databases and found a quarterly report. One line under revenue highlights said, projected savings from reduced nursing hours per patient, $14.7 million annually. Lorraine leaned back in her chair, stunned. She whispered, "They sold neglect as innovation." That weekend, she showed the documents to her mother. Evelyn listened quietly, her hands folded in her lap. So, all this time, the machine was working exactly how they wanted it to, she said softly. "Yes, Mama, it's not broken. It's doing its job." Evelyn nodded slowly. "Then it's not the computer that's wrong. It's the people who told it what to value." The following Monday, Lorraine filed a formal complaint with the state's eldercare oversight board. She attached the documents, highlighted the fine print, and wrote in her statement, "If a system saves money by giving less care, it is not innovation. It is neglect with an invoice." A few weeks later, a local journalist contacted her. "I read your complaint," he said. "You're right. This isn't just your mother's nursing home. That same system is used in more than 30 facilities statewide." Lorraine felt a mix of anger and relief. At least now, she thought, the truth had a trail. Every injustice leaves a paper trail. Sometimes it's hidden in spreadsheets, sometimes in policy manuals, sometimes in the polite language of efficiency. Follow the paper long enough, and you'll find what people really value. That night, Evelyn wrote another note in her journal. "They said the computer was here to help. It helped them first." She underlined it, then added, "When care is managed like money, compassion goes bankrupt." Next, Evelyn and Lorraine discover that the same system is hurting families across the country. Their story begins to echo through newsrooms, hearings, and homes that now wonder who or what is deciding how much care their loved ones deserve. A month later, the story broke. The local newspaper published an article titled "Algorithmic Neglect: When Nursing Homes Trust Computers Over Care." Lorraine's complaint had become the headline. The piece included interviews with families from other towns who had the same experience: call buttons unanswered, visits delayed, residents labeled low priority. When Evelyn saw her daughter's name in the paper, she felt a strange mix of pride and disbelief. She had never thought her quiet life would end up on a front page. She told Lorraine, "I'm proud of you, baby. You turned my pain into proof." Lorraine smiled. "We're not done yet, Mama. This is bigger than one home." Within days, other families began reaching out. A retired nurse from Alabama wrote, "I was told the same thing, that my father was stable right before his blood pressure crashed." A woman from Ohio said, "My grandmother's file said low risk. She passed away that night." The stories poured in from across the country. Each one carried the same quiet horror. A system designed to save time had instead stolen it from those who needed it most. News crews came to the nursing home. The director gave a short statement in front of the gates. "Our facility remains fully compliant with all regulations," he said. "The system is meant to assist nurses, not replace their judgment." Behind him, Marissa watched from a window. She whispered to another nurse, "If only they'd let us use our judgment." A few days later, a national news network ran a segment about CareTrack. The anchor said calmly, "The software is currently used in over 200 nursing homes, many serving low-income and minority seniors." Evelyn sat in her recliner, listening. She thought about the faces she had seen in the halls, the tired nurses, the quiet residents, the ones who pressed buttons that no one answered. She whispered, "It's not just me. It's all of us."
The following week, the advocacy group invited Lorraine and Evelyn to speak at a town hall. The room was packed with families holding folders of medical records and printed complaint forms. Lorraine stood behind the microphone. Her voice shook at first, but grew stronger.
These systems decide who gets seen, who gets helped, and who gets ignored. But we were never asked how we wanted to be measured. Applause filled the room. Evelyn spoke next, her voice low but firm. They told me I was low priority. Maybe that was true for their machine, but I know what my life is worth. A man in the front row stood up and said, "My mother's home uses the same software. Can we stop it?" Lorraine looked at him. Yes, but not alone. Soon after, the story reached Washington. A senator requested a formal review of predictive care algorithms used in eldercare. The Department of Health and Human Services announced an investigation into whether the systems disproportionately harmed Black and low-income seniors. The news anchor's words made Evelyn sit straighter in her chair. For the first time, fairness audits for eldercare technology may become law. She smiled softly. Maybe that's what progress really looks like. Not silence, but a conversation that finally starts. One night, Marissa came by after her shift. She handed Evelyn a folded newspaper clipping. "Look," she said, "they quoted you, Ms. Carter, right here." Evelyn adjusted her glasses and read the line aloud. They said the computer was here to help. It helped them first. She looked up at Marissa and smiled. Well, maybe now it's starting to help the rest of us. When harm becomes pattern, accountability becomes possible. A single story may be dismissed, but 100 stories draw a map. And once the map is visible, change can find its way. That night, Evelyn wrote in her notebook, "We were not isolated cases. We were proof of a design. They built a system to save time. We built a movement to save lives." She closed the notebook and whispered, "The silence is breaking." Next, Evelyn's story reaches the people who built the system. For the first time, they listen not to data, but to the voices their program forgot.
By late summer, Evelyn and Lorraine were invited to speak at a public hearing in the state capitol. The panel included lawmakers, medical directors, and executives from the company behind the CareTrack system. When their names were called, Evelyn leaned on her cane and walked slowly to the microphone. The room was cold, full of papers rustling and polite faces pretending to listen. She took a deep breath. "My name is Evelyn Carter. I'm 72 years old. I trusted this system to keep me safe. It decided I was low priority." A few people looked up. She continued, "I pressed a call button that no one answered. I almost lost more than my patience. I could have lost my life." Lorraine placed a hand on her mother's shoulder. Evelyn steadied herself and said, "I'm not here to blame nurses. I'm here to remind you that care can't be managed like inventory." The room was silent. After the hearing, a state senator approached them. "Mrs. Carter, your story makes this real for us. We've read the reports, but hearing it from you, it's different." Evelyn smiled faintly. "I guess the computer forgot to measure different, too." He nodded. "We're drafting new legislation that will require human review for every AI decision in eldercare." Lorraine crossed her arms. "And will it be enforced, or will it just look good on paper?" The senator didn't flinch. "Both, if we do it right." A few weeks later, the advocacy group organized a meeting between families and the CareTrack developers. Lorraine didn't want to go, but Evelyn insisted. "If we want them to change it, we have to show them what it feels like," she said. The meeting took place in a hotel conference room. The developers looked young, wearing lanyards and laptops like armor. One of them, a man named Daniel, said softly, "We didn't mean to hurt anyone. We were just trying to make nursing easier." Evelyn nodded. "You did. For a while it worked for the nurses, but not for us." Daniel looked down. "We didn't realize the data left people out." "You didn't look close enough," she said. Kindly, not cruelly. "You measured numbers. We needed you to measure people." The company agreed to partner with the advocacy group to rebuild the model. They called it the Human First Audit. For the first time, the software would include data from public nursing homes, Medicaid patients, and communities of color. Evelyn was invited to join as an advisor. She laughed at first. "I don't even own a computer," she said. "That's why we need you," Daniel replied. "You'll keep us honest." Over the next few months, Evelyn attended virtual meetings with the team. She learned new phrases: bias check, fairness review, transparency clause. But she never let the jargon distract her from one question: does it make care feel more human? When they showed her a new version of the interface, she asked, "What's this new color?" Daniel explained, "Blue means human review required." Evelyn smiled. "Now that's a color I can live with." The following spring, the state passed the Elder Fairness in AI Act. It required every nursing home using automated care systems to provide manual overrides and patient access to their digital records. At the signing ceremony, the governor shook Evelyn's hand. "Mrs. Carter, your voice helped write this law." She smiled. "I didn't write it. I just reminded everyone what care is supposed to mean." That night, she sat with Lorraine on the porch. The air smelled of rain and magnolia. "Mama, did you ever think it would come to this?" Lorraine asked. Evelyn laughed softly. "I just wanted someone to answer my call button. I didn't know it would start all this." They sat in silence for a moment. Lorraine said quietly, "You fixed it, Mama." Evelyn shook her head. "No, baby, we fixed it. The nurses, the families, the people who refused to stay quiet. That's how it gets better. Together." Progress doesn't come from machines or policies. It comes from persistence, the kind that starts small in quiet rooms and grows loud enough to reach the people in charge. Before bed, Evelyn wrote in her notebook, "Who can fix it? The ones the system forgot. How can they fix it? By reminding the world that care isn't a calculation, it's a promise." She underlined the last word and closed the book. Next, Evelyn's story comes full circle. Her final days in the home show what happens when compassion finally takes the lead and when technology learns to follow.
A year later, Evelyn Carter walked through the same hallway that had once kept her waiting. The walls looked brighter now. The quiet was still there, but it no longer felt like neglect. It felt like calm. A new nurse named Janine greeted her with a smile. "Good morning, Miss Carter. Ready for your therapy session?" Evelyn nodded. As Janine helped her to the chair, she noticed the monitor above her door. The light that used to glow green now shifted softly between colors. Blue appeared every few hours, signaling that a nurse should check in even when no alert was active. Evelyn smiled. That was the color she had asked for. Later that morning, Daniel from the tech company visited the facility. He wore the same anxious grin he had the day they met, but his voice was steadier now. "We've rolled out the new system statewide," he said proudly. "Every facility has human review built in." Evelyn nodded. "And how's it doing?" "Better," he said. "But we still have to remind people that technology doesn't replace care. It supports it." She laughed softly. "Sounds like it's finally learning manners." He smiled. "Thanks to you." When Daniel left, Evelyn sat in the courtyard. The fountain trickled nearby, and the spring air smelled of fresh rain. She remembered her first night here, The red light blinking, the call button ignored, the ache of being unseen. Now she could hear nurses talking, laughing, moving from room to room. They weren't rushing anymore. The system gave them space to notice things again. A missing meal, a frown, a sigh. She closed her eyes and whispered, "That's what care sounds like." A few weeks later, the home hosted an event for families. Lorraine stood beside her mother as the director thanked everyone for their patience during the changes. "We've learned that no machine can replace human judgment," he said. "Our best tool will always be listening." Evelyn stepped forward and spoke briefly. "I didn't plan to become anyone's lesson," she said. "I just wanted to be seen. But if my story helped even one person get better care, then it was worth it." Applause filled the room. Lorraine wiped her eyes. "Mama," she whispered, "you turned a bad night into a new beginning." Evelyn smiled. "That's what living long enough will teach you, baby. Every mistake can turn into wisdom if you're willing to share it."
That night, back in her room, she opened her notebook, the same one she had kept through every step of her journey. The pages were nearly full. She turned to the last one and began to write in slow, steady handwriting. "The system once called me low priority. Now it calls me Miss Carter again. It still counts my vitals, but it also counts my visits, my voice, my care. Technology may predict, but only people can notice." She paused, then added her last line. "A good system counts hours. A good nurse counts heartbeats." Evelyn's story didn't end with a new policy. It ended with a reminder. Technology can track recovery, but it can't measure dignity. That must always come from us. Across the country, nursing homes began adopting new standards: human review, transparent data, and resident rights printed in every room. Some called it the Carter Clause. The camera would fade on Evelyn sitting by her window, light washing over her face. Her notebook lies open on the table beside a cup of tea. Compassion isn't an upgrade, it's the default setting. If this story moved you, share it. Someone you know might be living through a quiet night that shouldn't be silent. Subscribe to Older Black Person Stories, when data meets dignity, for more true stories about courage, fairness, and care that remembers the human touch.